Greetings. Now, I want to tell you the causes of gestational diabetes. And gestational diabetes is a type of diabetes where um, found in women that were previously not diabetic, but because they took in, their blood sugar become uncontrolled, or their blood sugar become high, so they will be diagnosed with gestational diabetes. And the common symptoms of gestational the symptoms are not clear cut. They are not clear cut because sometimes a woman will have gestational diabetes and not even know. But in some women, the symptoms is taste. They will be drinking a lot of water, and it does not mean when the weather is hot. Oh, the weather is hot. Does not mean when you are drinking a lot of water now you now say you have diabetes. That's my warning. And they will be urinating too much. Those are just the two side effects, and sometimes they feel weak. Generally, pregnancy make you feel weak, but it does not mean that because you have these symptoms, you automatically have gestational diabetes, right? Some tests will also be done on you to be sure that you have gestational diabetes. That is that. Before I continue, I want to plead with you to subscribe to my YouTube channel. I have a YouTube channel. That is also, I want to also be this active as TikTok. I have a YouTube channel. The name of my YouTube channel is is Nigerian Health TV. The link is in my bio. It's right on your screen too. Please, you can take a pause and go and subscribe to my YouTube channel and continue watching this video. Please. Thank you. Now, back to gestational diabetes. What causes gestational diabetes? What causes gestational diabetes? Well, the real cause of gestational diabetes is not known. That's the truth. Medicine, science have not been able to unravel the cause of gestational diabetes. But there are some risk factors that has been found to cause gestational diabetes. There are some risk factors in the woman that has been found to cause responsible for gestational diabetes. Now, one of which is obesity. Some women they are overweight before they took in, and because they are overweight before they took in, their risk of developing gestational diabetes is high. Number two cause of gestational diabetes is family history. If your mother had gestational diabetes, or your auntie had gestational diabetes, or your grandmother, as a pregnant woman, the risk of you having gestational diabetes is also high. So the risk is also there. Another cause of gestational diabetes is if your previous pregnancy, your baby weight was around 4 kg, or you had the big baby in your previous pregnancy, the risk of you having gestational diabetes is high. That's the truth. The risk of you having gestational diabetes if you had a previous big baby is high. So look at the weight of your last baby. Was it 5 kg? Was it 6 kg? Was it 4 point something kg? If the baby is high, baby's weight is high, this your current pregnancy, you stand a chance of developing gestational diabetes. Those are just risk factors. It does not mean that risk factor means that women with these issues are be found to later develop gestational diabetes. I've mentioned family history, I've mentioned obesity, I've mentioned previous pregnancy, I mentioned, yes, if you have diabetes before, if you are previously diabetic, and you're now taking, you have gestational diabetes, right? If you are previously diabetic, you're now taking, you have gestational diabetes. Women that are Black, Asians, and Americans also have higher risk of developing gestational diabetes. This category of women, Black women, Asian women, and Americans, especially Blacks, they are at high risk. They stand a chance of developing gestational diabetes during their pregnancy. Is there anything I've forgotten? Okay, obesity. There's one. Women that don't exercise during pregnancy. Women that don't exercise, because you are pregnant, your lifestyle, you have become suddenly very sluggish. You no longer want to involve yourself in any activity. I'm feeling hot here. You no longer want to involve yourself in any activity. You are just sitting in one place, lying in one place. Yes, it can happen because you can fall sick during your pregnancy. It can happen. But also make sure that you are active a little, so that you will not develop gestational diabetes. If you're always sitting there in one place, your risk of developing gestational diabetes is high. So be warned now. Make yourself active. Try and still do something in the house. I'm not saying you should do vigorous exercise or walk around the house. Still do one or two. I've mentioned close to 7 causes of gestational diabetes. I said the cause is not known, but there are risk factors, one of which is obesity, sedentary lifestyle. You don't do anything, you are just sitting in one place. And there's one, they say you are eating sugar food, but that one is a lie. There's this belief that if you eat sugary food that you have gestational. No, say sugar cane and the rest. No, that's not true. The most important risk factor for gestational diabetes is that risk factor. And also, if you have preeclampsia, if you have preeclampsia in pregnancy, yes, if you have preeclampsia in pregnancy, like hypertension in pregnancy, the risk of you developing gestational diabetes is high, because hypertension and preeclampsia seem to go hand in hand. So that's that. Before I go, please, I want to beg you again to subscribe to my YouTube channel, and using the link in my bio. And the name of my YouTube channel is Nigeria Health TV. Thank you and bye-bye. You can put your questions in the comment section. I'm going to answer them. Bye-bye.